it's Melanie. I feel like I am sitting really low. I think that my exercise ball is losing some air because I'm just so low to the ground right now. I should probably put some air in this bad boy. Anyway, I wanted to do my first update for you guys in regards to my Coolsculpting treatment that I had done. I had the first treatment just about 5 days ago now, and I wanted to wait a few days after the treatment to see if there were going to be any side effects that popped up. So in this video, I wanted to tell you guys about that, what the first treatment experience was like, what I'm going to address in my second treatment, which I'm pre-recording this, so I'm actually uploading this the same day that I'm having the second treatment done, if that makes sense. I wanted to also share with you guys how much I paid for the treatments that I chose to purchase, and just share any like little bits of information that just kind of pop into my head as we go through this little vlog. So if you missed the very first video that I shared about this little Coolsculpting journey that I'm doing, I will link that down below. Maybe check that video out first and then come back to this one, because any questions that you may have may actually be answered in that first video. So I had the first treatment done about 5 days ago, and honestly, it was so much easier than what I expected it to be. I snapped a little bit during the treatment and just kind of shared with you guys what it felt like and you know, what generally like was happening during the treatment. So when I got into the office, they had me fill out a little bit of paperwork, which was basically like, you know, explaining what the side effects could be. They wanted obviously information on any medication that I was taking, if I had any like pre-existing conditions. A big thing apparently was making sure that I didn't have a hernia or anything like that. High blood pressure, things like that. Sensitivity to cold, which would be a big deal in this case because they're freezing your fat. So you don't want to have any sensitivity to cold. And I didn't have any of those things. It's just the usual paperwork that, you know, you sign off on when you go and have a cosmetic procedure done. So I go back into the room. It's just a really comfortable room. They only have one machine, so I did have to have each side done separately. I know that at some places they do have two machines, so they will do both sides at the same time so that you're done even quicker, but that was not the case. So basically, she had me undress, she had me stand in front of her. We already took all of my pictures at my consultation, and she sort of drew on me where the biggest area of fat was in my inner thigh area. So she drew in permanent marker, and you know, she had a template that she used that was the size of the applicator that she later applied. And she then put this cooling gel. Well, it's not a cooling gel. So first she did like this prep treatment, which sort of cleansed the skin and prepped the skin. Then she applied this, it was a cloth that was covered in this like sticky gel stuff. The sticky gel stuff is meant to protect your skin against any kind of like frost nip or frostbite essentially. And it was really sticky. So she put that on, smoothed that out, and then put the applicator on. And basically what happens is she kind of like hovers it over the area, centers it perfectly where she drew in that permanent marker. And basically as soon as it like touches the skin, it just like, it like sucks on, and you can feel like sort of this like suction or almost like pressure of your subcutaneous fat and skin and all that stuff sort of being sucked into like the little cup. So this is kind of what I imagined that my little fat pocket looked like. Is it was just like this little like mound inside of the applicator. It was kind of a weird sensation, but it didn't hurt. Like, it was uncomfortable in the slightest way possible, but it didn't hurt in any kind of way. Then she had me sort of pivot and get onto, because she put the applicator on while I was standing so that she could really like suck in the fat that that was there when I was standing. So then she had me pivot, sit. She put all kinds of pillows around me, and it was super comfortable. She put the little reclining seat back, and my feet were up, and she turned the lights out and was like, enjoy the next 35 minutes. And so I was just able to play around on my phone. The only thing that I felt was an intense cold, obviously, in my inner thigh area, which, you know, didn't last very long because you go numb very quickly. And when the 35 minutes was up, she came back in, she removed the little applicator, she massaged the area for 2 minutes. She like had a timer and everything. Massaging the area for 2 minutes really does help to increase the number of fat cells that die. I guess they've done studies on this, and it really does help. She was kind of implying that it would be really uncomfortable, and I've heard from a lot of videos that I've watched and blogs that I've read that this was a really uncomfortable thing for a lot of people, but for me, I felt kind of good. I was like, could I have an inner thigh massage every day? It really wasn't uncomfortable in any kind of way at all. The skin just looked really red. I'll insert a picture at the end of what it looked like right after she removed the cup and massaged it. I expected it to look like a hunk of like frozen butter, which is what I think a lot of people experienced in the past when they had the older version of Coolsculpting done. But this new one doesn't suck up the skin as far into the applicator. So it actually makes more people candidates for it because you don't need as much to suck in, if that makes sense. So she then repeated the process on the other side, and 35 minutes was up. She came in, she massaged, and then she basically just kind of told me that I just needed to stay hydrated, which is what I've been doing for the last 5 days. I'm trying to at least drink 1.5 liters, if not more, of water each day. That's a lot of water for me. I know for some people that's like bare minimum, but that's a lot for me because I hate water. I hate it. I've been trying to mix it up by also adding in some sparkling water as well. You know, not any kind of like water that has artificial sweeteners or sweeteners in it at all. It's just sparkling water from Talking Rain. So I've been trying to mix it up that way to encourage myself to drink even more. And I kept waiting for some of the like potential side effects to show up. So there could be possible swelling, there could be bruising, there could be just general like discomfort in the area. I'm trying to think of what else. I think swelling, bruising, discomfort, delayed like sensation type feelings, like that pins and needles feelings, or not being able to feel the area at all. I regained sensation probably within about an hour after I started to feel my thighs touching again. When I was walking out to the car, I had this moment of, oh, this is what girls with like a thigh gap must feel like when they're walking, because I couldn't feel my thighs rubbing together. They still were, don't get me wrong. Things are not progressing that quickly, but I couldn't feel it because my thighs were numb, and I was like, oh, this is so great. These girls must all be so happy to not have their thighs rubbing together. Like it was so funny. I actually like was messaging with a couple of my girlfriends, and I was like, holy crap, like you have no idea what this feels like. It's amazing. Like you can't feel your thighs rubbing together. It's so great. But then I got the feeling back, and I was like, oh, back to normal. So it came back within about an hour, but nothing, like no side effects, no bruising, not a thing, you guys. It was so easy. I almost felt like, did I do it wrong? Like, was I not a good candidate? But she assured me that yes, it's just gonna take some time. But if you don't have any side effects, you don't have any side effects. Not everybody does. So Anyway, it's just been easy breezy. The hardest thing, honestly, is the water consumption. The water is needed to begin to flush the fat out because when the fat starts to die, it basically, your lymphatic system will flush it out. So you're going to pee it out. You're going to sweat it out when you're at the gym. By the way, I was back at the gym the same day, literally 2 hours later. It was that easy. Like, it was so easy, you guys. I mean, I don't want to say that like everybody's going to have the exact same experience, but I've heard some people say like, oh, it was so uncomfortable and I couldn't do anything for days afterwards. And then some people were like me and they were like, easiest thing I've ever done. I could do it all day. Quite honestly, it was so nice and relaxing that I was like, I would purchase more of these just to have quiet time. Because it was such a breeze. I mean, maybe the tummy would be a more sensitive area, perhaps. I don't know, but I have no complaints. I'm gonna be doing it again. In fact, when you guys are watching this video, I'll be there for my second treatment. The second treatment will be, so I'm with the inner thigh, they don't retreat for at least 3 months after. Because you're losing fat during those entire 3 months. So I decided that I would probably be pretty happy with just losing about 20 to 25% of the fat in like the middle part of my thighs, and then addressing they call it the banana roll area. It's the area right underneath your butt that is just kind of like a little fat pad there. And mine is more obvious towards the like inner part of my thighs. So she's going to attach it just right there the next time around. So it's going to be right underneath my bottom, and it's going to kind of wrap around like into like my inner upper thigh area, if that makes sense. And I think that once that fat starts to melt, I'm going to see a significant amount of slimming in that area overall, to where I can actually wear my size 10 pants very comfortably, because I am a size 10 except for my friggin' thighs. Like, those are like a solid 12. So I'm just hoping to have enough slimming to where my pants just fit much more comfortably and I don't have the extreme amount of chub rub that I have currently. So that's what I'm doing for the second treatment. How much did I pay? Okay, so price varies from city to city, practitioner to practitioner. My plastic surgeon's office charges $750 per cycle for the kind of average applicators. Now, if you're doing the large tummy area, that is considered 2 applicators, so that's more expensive. But it's about $750 per cycle. So obviously I have 2 legs. So that would mean 2 cycles if I was just going to do it once. But I wanted to do the banana roll area as well. So I needed to purchase 4 cycles. So $750 times 4. However, my surgeon's office has these girls' night out events where when you go and you listen to the presentation and you purchase your package there, you save a significant amount of money. So I decided to just go and see how much I could save. I assumed I could save maybe like $100. I saved several $100s by going to this little open house, and it was great because like there were drinks there and appetizers, so I got to eat and listen to the presentation and learn more about other things that the clinic obviously offers. But I purchased my package there the night of, and it was $2,100 for the 4 cycles. So that is what I paid. I know that that is probably excessive to a lot of you, just based on the number of thumbs down on that last video. I'm sure a lot of people were like, oh God, you're spending money on that. And it's fine. I work very hard. I have my own business and I work my ass off. So I've been saving for this. It's not something that I'm financing or anything like that. I just paid for it out of pocket because I've been saving my tips. I've been, saving extra money here and there. And just paid for it out of pocket. So I think that after the 4 treatments, I will be good. I'll be very content with the outcome. I'm pretty sure. You know, even if it's only 20 to 25% per area treated, I think that is more than enough for me. I'm not looking to use this as a weight loss technique or anything like that. She did weigh me prior to doing the treatment, and I was 187 pounds, so that is what I weigh. I think sometimes people are surprised when I tell them what I weigh, because I think I'm very muscular. I have a lot of muscle and I do lift a lot. I said that in my first video. So a lot of it is muscle weight. I'm 5'7". I think I'm pretty proportionate. I'm happy with the way my body looks for the most part. I'll be curious to see if that does come down. I'm not doing any dieting. I'm not planning on dieting. I'm just gonna keep doing my regular gym routine, which is 6 days a week for 1.5 hours. I'm just gonna eat my regular food. I don't have the kind of lifestyle that allows me to have a special diet, because I don't have any interest in doing that. It's not really a lifestyle thing, it's just that I don't want to, so I don't. I just watch the amount of food that I take in. So I'll be curious to see if there is any kind of change in weight from that little bit of fat loss in that area. I don't expect there to be a drastic difference, but I will of course let you guys know. But I'm trying to think of what else. I think the one thing that I didn't stress enough in my last video is making sure that you find a physician or an office that is trained in this procedure. I thought this kind of sounded silly, but when I got my consultation, the lady who did my consultation was telling me that she had gone to Coolsculpting University, to which I was like, what? But what it is basically like an in-depth training course on how to use the Coolsculpting machine, figure out who the best candidates are, how to properly apply, you know, what patients have contraindications that don't make them good candidates for the procedure, so that you're not like getting unhappy clients, you know? So I thought that was a big thing. So when you go to a physician or somebody, ask if they have been to this Coolsculpting University, because it's basically just an in-depth training course on how to use the machine properly and get the best possible results from it. Anyone can buy these machines, you know? But knowing how to use them is the big deal. You have to know how to use them properly. And there have been people who have had bad results from Coolsculpting. And I don't know if that was because their physician either wasn't trained properly or the nurse wasn't trained properly, or if they just weren't a good candidate for it. I don't know. But you want to make sure that whenever you have anything done, that you ask about all the possible side effects, that you tell them any pre-existing conditions or issues you may have, so that they can tell you, yes, we're comfortable doing this, and don't lie to them. You know, if they ask you, like if you have a sensitivity to cold and you do, but you lie and say you don't so you can have the treatment done, that's probably not going to work out in your favor. So don't fib to the nurses or the doctors. Just tell them the truth. If you're not a good candidate, there's other things that you can try. There is another option called sculpture, which actually heats up the fat. That's not really good for inner thigh areas, so I chose to not do that one, but you might want to look into that. Some people respond really well to sculpture, so that's another thing to check out. But yeah, that's kind of the main thing that when looking back on my other video that I was like, I should have probably stressed that a little bit more. Go to a reputable clinic or physician's office to have this done. Don't buy a Groupon for it. That just seems like a bad idea to me. If something is too good to be true, it probably is. And have realistic expectations. That's the main thing. So if you still have some weight to lose, go lose your weight and then have this done to finish it off for yourself. So anyway, let me know if you guys have any other questions. I will be doing a update probably in about a month and a half from now to let you know how both the inner thigh and banana roll area are going. I have high hopes, but who knows? It could take the full 2 to 3 months to see any results. Most people start seeing some kind of results at around 6 weeks. That's when the fat really starts to flush out. But like I said, for the inner thigh, it could be up to 3 months before that entire like healing process is done in that area. So I'll be doing an update in a month and a half, and then I will do a final update probably maybe middle of the summer. So hopefully you guys are enjoying this series. Please leave me any questions down below. I might do a Q&A video. Yeah, just anything that you guys are curious about. I want to be really honest with you and straightforward. I've always been that way. So if you have questions, feel free to ask, because in all likelihood, I will probably answer. So thanks a lot, you guys. Please subscribe if you are new to my channel, and I'll see you in my next video. Take care. Bye.